Why do lung tumors cause muscle weakness that gets better with use? Now, this is one of the most important concepts that will be tested on the USMLE. So let me make it simple. I'll first start by asking you a question. Where is acetylcholine released from, and what needs to happen at that nerve terminal for the release to occur? Because if you understand that, this whole concept will make sense. All right. So normally when a nerve signal arrives at the neuromuscular junction, calcium floods into the presynaptic nerve terminal through voltage-gated calcium channels. That calcium influx triggers acetylcholine release into the synapse. Acetylcholine binds to the muscle, and the muscle contracts. Now, in a certain type of lung cancer called small cell lung cancer, which is basically a neuroendocrine tumor, it starts expressing proteins that looks like voltage-gated calcium channels. The immune system starts attacking the cancer, which is good, but the antibodies also attack the calcium channels on your nerve terminals, which is bad. With fewer functioning calcium channels, less calcium gets in, less acetylcholine gets released, and you get weakness. This is called as Lambert-Eaton syndrome. But here's the beautiful part that explains why Lambert-Eaton improves with use. When you repeatedly stimulate the nerve, like when you keep using the muscle, calcium accumulates in the terminal with each signal. Eventually, enough calcium builds up to the trigger adequate acetylcholine release, and strength actually improves. This is called as facilitation. So on the USMLE, they'll give you a patient, usually a smoker with proximal muscle weakness, maybe dry mouth, and other autonomic symptoms. And the key finding, strength that improves with repeated muscle contraction or exercise. Reflexes are diminished but get better exercise too. The clinical pull, any patient with this Lambert-Eaton syndrome needs a CT chest to look for small cell lung cancer. In some cases, the weakness shows up before the cancer is even detected. So this syndrome can actually lead to an early cancer diagnosis.